Welcome to the Get to the Root podcast, where we build your health from the ground up. At Root Functional Medicine, we're on a mission to bring sustainable and validated functional medicine to the world. As a team of doctors and dietitians, we are dedicated to treating gut health, hormones, autoimmune conditions, and metabolic health at the root cause through advanced testing, food as medicine, and telehealth programs. For years, we've been helping people get to the root of their health concerns. Now, we're here to share our knowledge so you can benefit too. Stay tuned and join us as we get to the root.
Welcome back to the Get to the Root podcast. I'm your host, Dr. Erica Armstrong, and today we're talking about a highly trending topic, GLP-1s, and are there alternatives to GLP-1s? In this podcast, I'm here with our guest, Dr. Katherine Stam, who is both certified in family medicine and functional medicine. She's a physician who has a background in working in obesity medicine before Root. She worked at a weight loss clinic, and she's been in the weight loss industry for a decade. So these GLP-1 receptor medications are Ozempic, Wegovy, or generic semaglutide, or others in this class, are getting a lot of attention for weight loss, but are they the ultimate solution? This conversation is important because of the need to focus on root cause solutions rather than just medications. Our doctors at Root are MDs and DOs and can and have prescribed these medications. But the bigger thing that we do is reverse root causes, including inflammation and more. So one of the problems with relying solely on GLP-1 medications is that studies show many people discontinue GLP-1 medications due to side effects and cost. And Dr. Stam, welcome. You're so well-versed on these medications and have such important background to be able to discuss these in both conventional and functional medicine. And I wanted to ask you, what have you seen regarding how many people going to discontinue GLP-1 medications?
Well, really, the statistics show that people discontinue these medications at a significantly high rate due to side effects and cost. So discontinuation rates at 3 months is about 25%, at a year about 50%, and 2 years actually 70%, close to 70%.
Wow, that's a high discontinuation rate for something that's being proposed as a long-term solution when over half of people are not even taking it after a year. And then what happens after they stop? How common is weight regain when people stop the medication?
So sadly, when you stop these medications, most people will regain almost all of their weight, if not more, within the first year of stopping.
Okay. Yes. Wow. And are there any particular reasons for that, regaining all of your weight or more than when you were on the medication?
There are a few theories. There is one theory that there is actually like a rebound hunger that you can get. The other is well known. So when you lose weight without these medications, you're losing usually like 15 to 20% of your lean mass. But with these medications, the weight loss is very rapid and drastic. And the lean mass loss can be up to 60%. So our lean mass is our muscle mass, our bone mass, our organs, and lean mass, specifically our muscles, drive our metabolism. So if we're losing muscle mass, significant amount, 60% of our weight loss, it's going to slow our metabolism down. So when we start eating the way that we were before we took the GLP-1 agonist, it's going to be easier to regain that weight.
So it's really important to still focus on nutrition, and especially protein, when using these medications, and they're not the sole solution.
Absolutely.
Yes. So the other thing that we touched upon was side effects. Many of us are familiar with the side effects being nausea, vomiting, stomach distress, maybe some long-term effects that are still unknown. One of the things in functional medicine that we tend to foresee things before conventional medicine has enough what they say evidence to make claims about side effects. And one of the things in functional medicine focusing on the gut is we see a lot of SIBO, or small intestinal bacterial overgrowth. And that's when too much of the microbiome is growing right in the small intestine, right after the stomach. And certain things set people up for SIBO, which causes bloating and other issues too with inflammation stemming from the gut. One of the things that sets people up for SIBO is slow motility, or that the food and stool is not moving through the gut. And so it sits there and becomes like a breeding ground for overgrowth of bacteria. Dr. Stam, do you see that these drugs may be setting people up for SIBO?
Yes, absolutely. One of the main effects is slowing gut motility, slowing gastric emptying. And that side effect actually does not always go away. These medications can result in long-term gastroparesis, or slowing of gut motility. So absolutely can be a factor in the development of SIBO.
Yes, and at Root, we would do things to support and prevent that, including some of the nutrition advice and things that can help support motility, even things such as vagus nerve training. It's important to have that additional component to your care if you're on these medications. Another big reason that GLP-1s are in the press is the healthcare costs. Healthcare costs, a lot of it are medication driven, especially recently. And these medications are expensive. I think for this podcast you were mentioning, Dr. Sam, $1,300 to $1,500 a month, $16,000 a year. Are they worth it? Are they actually showing other reductions in healthcare costs? And there have been large studies kind of analyzing U.S. health insurance claims over a 2-year period, and patients who are prescribed GLP-1 medications have a 46% increase in annual medical expenses, primarily due to higher prescription drug costs. But in contrast, people who are not using these medications also saw a 14% increase during the same time frame. However, this study did not observe a decrease in obesity-related medical events over the 2-year period, so they did not curb healthcare costs within 2 years. While the GLP-1 medications are effective for weight loss, their high costs not offset. They may not be offset by health care savings ultimately. So side effects, costs, potential downstream effects. Katherine, what do you see as the biggest issue with simply using these medications as the main weight loss approach?
The biggest issue that I am seeing is that if you are not using a holistic approach to weight loss and just relying on these medications, you're not going to change habits. And it's not sustainable to be on these medications for the rest of your life. And if you're not changing how you're eating and getting adequate protein in, doing strength training, working on your gut health, etc., once you stop the medication, your metabolic rate is going to be much slower because you've lost lean mass, and the rate regain will be faster. And the benefits that we all hear about with the GLP-1s, including cardiovascular benefits, decrease in inflammation, decrease in neurodegenerative disease. I'm concerned that all of these potential benefits are going to rebound because as we regain weight and it's mostly fat, we are increasing inflammation.
Inflammation being a root cause, which GLP-1s can actually be helpful for. And, sometimes we use that as an additional way to combat inflammation. However, the root cause of inflammation is often in the gut, as you just discussed. I see one of the biggest issues being that if you're only taking a medication and do not change your nutrition, you're just eating less of the same toxic foods with nutrient deficiencies, protein deficiency, and not giving your body what it needs to heal and reduce inflammation long-term by impacting the gut microbiome. You also really need to learn to balance blood sugar through the protein, fat, and fiber balance on the plate. That's something that we do with every single member at Root. And so let's now talk about what we can do either in addition to the medication or what we can do instead. Functional medicine's approach to sustainable metabolism health isn't just about weight. It's about blood sugar balance. It's about mitochondrial function, inflammation, and gut health and hormone balance. So some of the key strategies may include, as you mentioned, protein. And Dr. Stam, what do you recommend regarding protein?
So the RDA recommends 0.8 grams per kilogram per day. But when you're losing weight, you should really increase that to 1.2 to 2.3 grams per kilogram per day.
Okay, so significantly more protein is needed, and probably it's going the opposite way when you're eating less. So really need to focus on the components of the food that you're eating. And can you talk a little bit about other strategies that we use for metabolism?
What we can do to support metabolism is to personalize our approach. So we can optimize nutrition, micronutrients, macronutrients, monitor and optimize insulin resistance, sensitivity, stress reduction. We know that cortisol is going to increase our blood sugars and contribute to insulin resistance and inflammation, as well as leaky gut. Work on improving our vagus nerve activation, adequate sleep, optimizing our gut health. It's very interesting that we're learning more about the microbiome and that certain bacteria in our microbiome produce something called short-chain fatty acids, which one of these is butyrate, which actually works as a GLP-1 agonist in itself. Another part of our microbiome is a bacteria called Akkermansia that also works as a GLP-1 agonist. Working on exercise, specifically strength training, whole body strength training, at least 3 days a week. And then some targeted supplements that we can use to help support metabolism and reverse insulin resistance.
Yeah, that's great. Big topic. Sorry, that was a loaded question there. I want to come back to a few of the things that you said. The short chain fatty acids, those are something that we call postbiotics. So you have your prebiotics, which is the fiber, and the bacteria and the microbiome eat those and then create these hormones or chemicals that actually can line and protect the gut, like short chain fatty acids, or impact other areas of the body, like the butyrate that you mentioned. We can really strategically get the right fibers there to the point that the person tolerates, as you mentioned, personalizing it, and so that you're producing your own GLP-1, which is more sustainable on multiple levels.
Absolutely. So we do make our own GLP-1s, and we can go over how we can boost that. Our endogenous GLP-1s hang around for about 2 minutes. These GLP-1 agonists that are synthetic, we don't make semaglutide in our body. They stay around for 7 days. So these are like supraphysiologic doses. The long-term effects of that, we actually really don't know. I mean, GLP-1s have been around now for probably close to 15 to 20 years. But at the higher doses that we use for weight loss, we've been using those for about 10 years. So we really don't know the long-term effects. So yeah, we actually make GLP-1 from eating food. And there are certain foods that are going to help boost our GLP-1, and one of those is protein, healthy fats, certain prebiotic fibers, and actually bitters. Bitters are a great way to increase our GLP-1 endogenous production. These are not going to be as extreme as synthetic GLP-1 agonists, but these are going to help with weight loss, satiety, insulin sensitivity.
Great. And insulin resistance is one of the largest reasons that we see for weight gain here at Root. And half of adults in the U.S. have some type of insulin resistance or prediabetes or blood sugar issue. And one of the things I think about with strength training, as you mentioned, is building muscle gives insulin somewhere to go and to uptake the glucose that the muscles need to make energy. And so that is one of the big reasons that strength training and continuing to have good muscle mass is important for metabolism.
Absolutely. In fact, the GLP-1s agonists actually work on the muscle. They work on many of our organs that we don't hear a lot about, but they do help improve oxidation of glucose in our muscle.
Okay, that's good to know. You mentioned some targeted supplementation. Can you mention a few of those that we might recommend at Root?
Sure. We can start with the microbiome that we were talking about earlier. So probiotics that are going to help produce these short chain fatty acids. Akkermansia, which directly helps produce GLP-1s. Berberine, which has many effects, but is in relation to GLP-1, it actually works as a bitter. So it activates bitter receptors. It also helps modify our gut microbiome to produce these short-chain fatty acids. Interestingly, it also has effects on insulin sensitivity. It works in a very similar way that metformin does. They're studying this as a natural PCSK9 inhibitor, which is if you don't know, it's actually a very expensive lipid-lowering medication.
Yes, thank you. Yeah, so tons of benefits of berberine that we've used at Root, and the rebalance of the microbiome is often the main reason that I would prescribe it.
There are others that we use at Root as well. We do use bitters quite frequently. We use bitters to help release pancreatic enzymes, produce and release bile, as well as stomach acid. In addition, we use some other supplements such as alpha-lipoic acid and acetylcysteine.
And these supplements have anti-inflammatory benefits as well.
Yeah.
Great.
Inositol also is a supplement that we use frequently to help with insulin resistance. Insulin resistance many times is one of the key factors of weight gain. Insulin is a fat storage hormone, and insulin is secreted at different levels depending on the macronutrients and the combination of macronutrients that we are taking in. At Root, we use many supplements to help with insulin sensitivity that will also then help with weight loss.
Yes, so I describe this in a similar way. Insulin resistance means you need more insulin to do the same work because it's not working as well. So high insulin levels tell your body to store food as fat. We want to lower insulin levels, but to do that, we've got to make your cells like to see insulin more, so they don't require as much to do their job. And so how do you do that? How do you lower insulin levels? Well, like you said, you're going to secrete insulin to a different extent depending on your macros, your protein, your fats, and your fibers. When you eat a high carb meal, you're going to secrete a lot of insulin, especially if there isn't a lot of fiber in those carbs. When you eat protein, you're going to secrete less, but you're still going to secrete some. And then when you eat healthy fats, you really don't have much of an insulin response at all to that. When you take those three and you balance it, and especially focus on enough protein, you're going to secrete less insulin. And over time, your cells will be more excited to see insulin because it hasn't been hanging around all the time. It will work better. Your insulin levels coming down means your body knows to store less as fat. Actually, the GLP-1s they started out as a diabetes medication to treat insulin resistance. But again, what happens when you take that away if you don't know this core way to reverse insulin resistance, which we use in our patented root plate method with a balance of protein, fat, and fiber. So that was a ton of scientific information. Let's try to put it together and let's talk about maybe a case study. Dr. Stam, a member, I work with lots of members with these issues, but kind of a typical journey that someone would experience with a Root functional medicine doctor to address metabolism issues.
Yeah, that'll be great. So I'm going to talk about a member that came in with goals of having a clearer mind, better focus, weight loss, fatigue improvement. And we started off with our Root Wellness Panel that includes micronutrient levels as well as insulin levels and blood sugar. She was started on our Root plate with balanced macronutrients, and we worked on balancing her blood sugar. We supplemented the micronutrients that were efficient on her wellness panel. She was referred for therapy and stress management to work on boundaries. And we reviewed some sleep hygiene and started her on some magnesium glycinate to help her sleep at night. Her blood results came back that she was also insulin resistant, and there were some concerns that she had PCOS, although she didn't quite meet the exact criteria. We started her on some Myo and D-chiro-inositol and continued her on the magnesium glycinate. So she noted 15 pounds weight loss in the first 2 months of working with Root with those interventions. Her fatigue and brain fog improved with her blood sugar balancing. At 3 months, she was down 25 pounds. At that point, we looked at her gut health and found that she did have some dysbiosis with overgrowth of some inflammatory bacteria and also some evidence of gluten sensitivity. We treated that, and we actually added some Root metabolism support, which is one of our supplements that contains berberine and alpha lipoic acid. Her insulin resistance continued to improve, and she was down 30 pounds at 5 months. We continued to work on her insulin resistance, and at 9 months, she was down 45 pounds. And her menses were regulated, she had less fatigue, and she had improved mental focus.
Amazing.
Yeah, it was really a success story.
Yes. How long had she been struggling before coming to Root?
So she actually had been battling with these symptoms for a few decades. In fact, with her pregnancy, she had gestational diabetes. She had been really struggling with this for quite a while.
Yeah, I asked that because we hear that quite a bit, where people have been struggling for years and they don't know if functional medicine is going to work for them. But routinely, we see that it does. And the reasons that it does is that somebody has finally personalized, looked at your data, looked at your gut microbiome, and given you something sustainable that you can do, which is the Root Plate method. And so you're successful. And then we have dietitians on our team who help you with that and all kinds of resources. That is an amazing success story. We have so many members who've experienced something similar because of our wonderful team and our processes at Root. And what we're trying to do is bring sustainable and validated functional medicine to the world. So with that, some of the key takeaways: GLP-1s do have a place in certain cases. Sometimes they may be life-saving, sometimes in smaller microdoses. They can augment an anti-inflammatory approach and are quite useful. However, it's really important to look at the whole picture to reestablish healthy eating patterns so that you're successful when you come off of the medication. As we know, the vast majority will be off after a year or definitely after 2 years. So we really want to set people up for success when that happens. Any other kind of key takeaways from you, Dr. Stam?
Yeah, I would just say that if you are trying to lose weight, I would work closely with somebody who is going to look at you in a holistic manner. And don't rely just on medications. This is a lifestyle change, and you want to do this in a healthy manner so that it's sustainable.
Yeah, that's great advice. Thanks so much, Dr. Stam, for joining me on the podcast today and for sharing your wealth of knowledge. So where people can find Dr. Stam, she is a Root physician. And if you head to our website, rootfunctionalmedicine.com, you can see how to access many more resources like this, articles, the supplements that we mentioned, and lab testing, like the root cause panel that Dr. Stam used as the first step in her case study that she explained. So thanks again, Dr. Stam. It's been a pleasure.
Thank you.
Thanks for tuning in to the Get to the Root podcast. If you found value in today's episode, don't forget to subscribe, share it with someone who might benefit, and leave us a review. For more resources and to connect with us, visit rootfunctionalmedicine.com. Remember, your health journey starts with understanding the root cause. Join us next time.